Hi, I'm Dr. Jaspal Singh, co-director of the Weill Cornell Center for Comprehensive Spine Care and assistant professor of rehabilitation medicine. I specialize in sports and interventional spine medicine. Today, I'm going to focus on core strengthening exercises. A strong and stable core is key in maintaining a healthy spine and preventing injuries to the lower back. Julianne will be demonstrating beginner, intermediate, and advanced core exercises. Abdominal bracing targets the deep transverse abdominis muscle. This is the muscle known as the corset of the spine. To visualize, think of yourself, you're about to get punched in the stomach. You brace yourself for impact, you contract those deep abdominal muscles. To do this exercise, start by lying on your back. Bend your knees and keep your feet flat on the floor. Hug your navel to your spine to contract your abdominal muscles. Hold this for 3 to 5 seconds, release and repeat. The Bettany curl-up is a great exercise to target your six-pack muscles, also known as your rectus abdominis. These muscles are key in flexing the spine. To do this exercise, lie flat on your back. Bend one leg up and keep your foot flat on the floor. The other leg lies straight. Take your hands behind your head. Raise your head and shoulders off the mat. Contract your rectus abdominis muscles. Hold for 3 to 5 seconds. Slowly lower yourself and repeat the exercise. The bird dog exercise is critical in strengthening the lower back muscles. These include the lumbar paraspinals and the multifidi. In this day and age, a lot of us are sitting at work, at home. Our lower back muscles tend to get weak. It's critical to strengthen these muscles by doing these exercises. To start, place your hands and knees on the mat. Keep your elbows, wrists, and shoulders in alignment. Slowly straighten one leg behind you. It's important to keep your pelvis level. It's natural to externally rotate, but you want to keep the pelvis level to engage these multifidi muscles. Hold this for 3 to 5 seconds and slowly lower it back to the mat. To do a more advanced modification, again, straighten your leg out. This time, straighten your opposite arm ahead of you. Here, the therapist has raised her neck. You want to keep your neck in alignment with your spine to prevent injury. Hold this for a few seconds, release back to the starting position, and perform the same exercise with the opposite leg and the opposite arm. The side plank is probably the most advanced and most difficult exercise that we're going to do. It targets the deep abdominal muscles, especially the obliques, and again, the transverse abdominis muscle. These muscles are very important in keeping you erect and keeping your core stable and strong. To do this exercise, start by lying on your side. Make sure your elbow is in line with your shoulder and your knees are bent. Slowly straighten your top leg. Push off your elbow and your knee and raise your pelvis and hips off the ground. It's very important to make sure your belly button is pointed straight. There's a tendency to either rotate up or rotate down, but make sure your pelvis is level. Hold this for 10 to 30 seconds and slowly release. To do an advanced modification, straighten both legs. This time, you're going to push off your elbow and your feet. Raise your pelvis and hips off the ground. Make sure, again, to keep your pelvis and belly button pointed straight. Hold this for 10 to 30 seconds. Slowly lower, and make sure you repeat this exercise on the opposite side. If you're interested in maintaining a strong core and a healthy spine, I recommend these exercises as part of your daily routine. However, before engaging in any new exercise, make sure you talk to your doctor. Thank you for watching. I'm Dr. Jaspal Singh.